An acutely unwell, critically ill patient have extremely deranged physiology. We often need to undertake various clinical intervention in these patients. We sedate them, take over and control their breathing. We commence drug infusions to support and sustain their circulation. Often, this patient needs to be moved, transferred from one location to another within the hospital, from emergency department to ICU or from ICU to radiology department, or they may need to be transferred to another hospital. When these patients are moved around, it is important that these patients receive the same level of care as they would receive whilst they are in the emergency department or ICU. The principle of do no harm applies to these patients as much as it applies to any other patient. Studies have shown that high number of patient safety incidents happen during the transfers. Transfer should be considered as a clinical intervention, and it is important to appreciate the risks associated with the intervention, and it is our duty to minimize the risks through proper education and training. Knowledge and understanding of the key aspects of transfer helps to improve the safety and minimize the risks associated with transfer. You need to know what are the physiological effects of transfer, the need for proper preparation and appropriate stabilization prior to the transfer. You should be also familiar with the equipment and the environment. You should anticipate and prevent common problems. You need to be aware of the specific issues associated with different modes of transport during transfer. So, when we are moving the sickest patient in the hospital, it is vital that the transfer team have the appropriate knowledge, skill and equipment to make the process of transfer as safe as possible. The following presentation illustrates how a critically ill patient should be cared for by the accompanying healthcare professionals when a patient is being moved from one location to another. Let's watch this clip where an unconscious, sedated and ventilated patient is being moved from one clinical area to another. The patient is being wheeled on the bed with the head end first. Let's go through this clip again and analyze it. It is an example of how not to transfer an critically ill patient. The accompanying personnel are facing away from the patient, monitor, ventilator and infusion devices. The alarm messages from the ventilator and the monitor are not being attended to and acted upon in a timely manner. This can lead to potentially dangerous consequences. If you don't pay close attention to the patient, monitor and other devices, any changes in the patient's condition or equipment failures can be missed and the patients can come to unnecessary harm. How then do we safely move this patient from one clinical area to another? A critically ill patient on a bed or a trolley must always be moved feet first. The accompanying medical staff should position themselves on the head end of the bed. This will enable them to maintain constant visual focus on the intubated unconscious patient, his airway, the monitor, ventilator, and the drug infusion devices. Any changes to the patient condition, any alarm messages on the monitor, any device alert, or any failure of the devices can be promptly identified and acted upon in a timely manner before the patient comes to any harm.